Good evening, Professor Reed. This is Tina Nordeen, and this is my physical assessment. And I have my son doing the videography, and I have my 17-year-old daughter here, and this is Natalie, and she is going to consent to agree to performing the physical assessment. Natalie, do you consent to doing the physical assessment?
Yes, ma'am.
Very good. Nathan, will you please scan the room to make sure that there's no papers or anything laid out for Professor Reed to see? All right. Okay, very good. All right, so we'll go right back here. All right, and so Natalie, just before I get started, I want to introduce myself to you. So I'm Tina Nordeen, and I'm your nurse practitioner today. And today we're doing a physical assessment for you because you've come in and you've shared with the nurses what has been bothering you. So before I get started, I always want to wash my hands. So I'm going to wash my hands to make sure that we take care of all the germs. And there's a certain way that you have to wash your hands, which I was doing some hand sanitizing today, but making sure that we have lots of good friction and everything. So making sure that we have good hand washing skills. So Natalie, can you tell me how old you are?
17.
And tell me your full name.
Natalie Nordeen.
Okay, and Natalie, do you know your race?
Yes, Caucasian.
Caucasian. And what is your date of birth?
August 27th, 2002.
Okay, and Natalie, can you share with us what brings you in to see us today?
I have a really stuffy nose, itchy ears, and also itchy eyes.
Okay, so just to repeat, you said you have a runny nose, your eyes are itchy, and your ears are itchy. Okay, so we're going to definitely see what we can do about taking care of that today for you. But before we get started, there's some questions I need to make sure that I ask so that I have a full history on what's going on here. So can you first tell me, when was the last time you have been to the doctor for just a general physical exam? Do you remember?
About 6 months ago for our cheerleading exam.
Okay, so you had a sports physical at that
Yes.
time, and did it show any issues with that at all?
Nope,
On that
I was
physical?
clear to go.
You were clear to go. And when you say 6 months ago, this is April, so I would say October, November, December, January, February, March, April. So about October-ish is of 2019. And you were cleared to go and participate in all sports, so that's good. So when they did that, they looked at all your cardiovascular, your respiratory, your musculoskeletal, and everything. So they cleared you for sports. Natalie, have you been ever diagnosed with any chronic diseases, meaning any like diabetes, asthma, COPD, anything like that?
I did used to have exercise-induced asthma, but I kind of grew out of it.
You outgrew that, okay. And I remember, well, as your mother, I remember you having exercise-induced bronchitis. But and Natalie, have you ever had any psychological or psychiatric issues? Have you been hospitalized for any like anxiety or stress or any type of hallucinations or anything like that?
No.
Okay. And I know that, Natalie, you said that you have seen a doctor in the past. And have you had any allergies? Allergies to medicines?
No allergies to medicine.
How about foods?
No.
And environmental allergies. When I say environmental, that's like pollen and dust, animal dander, animal hair, things like that. Have you got any allergies there?
Most definitely.
Okay. Do you know about your allergies? Can you describe
Yes.
those allergies?
I had to have that allergy test where they pricked my back and got all red and itchy, and I was about positive for all of them.
All of those
Especially
allergies.
pollen, grass, and dust.
Okay, so you have seen an allergist in the past.
Yes.
So for the purposes of our exam here, we're going to assume that you have not, and you'll see why later in the exam. So Natalie, also the next section that we will talk about is your family history. So when I talk about your family history, I'm talking about your grandparents, both your mom's parents and your dad's parents, your parents themselves, your siblings, and I understand you have just one brother. And then if you have any children. So share with me, do you have any children?
Definitely not.
Okay, very good. I'm glad of that. Okay, and so for your maternal, that's your mom, your mom's parents, do they have any medical history? And you may not know, so we can help you a little bit with that.
Yes, my mom's father had kidney cancer.
Kidney cancer, and he passed away at
Yes.
the age of 73. Okay. And you may not have known this, he also had hypertension and diabetes, and both were diagnosed in his early 50s. And then your mom's mother, or your grandmother, do you know what she might have? Okay, she also has diabetes and hypertension. So those are good things to know for you, for your family history as you are aging, just to make sure that you keep healthy because you do have a significant family history there. What about your father's father and mother? Do you know the history there with them? So your paternal grandfather has passed away as well. He was 70, was he 72? I'm talking to my husband over there, 72 years old, and he had cardiovascular issues. And then your paternal grandmother is living, and she has respiratory problems. So that's also good to know in your history. So how about your mother and father? Do you know their medical history?
They have hypertension as well.
They both have hypertension, and they were both diagnosed with hypertension in their late 40s. So good to know, and making sure that you know those things so that you can recognize your health history. So as far as your sibling who is holding the camera, does he have any health history that you know of?
Only migraines.
Yes, he has migraines, and he was diagnosed with migraines when he was in the 3rd grade, but he had them ever since he was like in the 1st grade. So that's good to know as well. So Natalie, tell me a little bit, now we'll go to what's called the social history. So tell me a little bit about where you were born. Do you know where you were born?
Augusta, Georgia.
Mm-hmm. And you were born in?
University Hospital.
University Hospital, and you had a normal birth, and you were not premature, and you did not have a C-section, so you were normal, and you got to come home just the day after you were born, and you were normal all around. And when we talk about I know you said you were Caucasian, but do you know your nationality or ethnicity? Do you know the difference in those? So you were born in the United States, and so your father is of European descent, and your mother is of Japanese descent. So I'm half Japanese and half French Canadian, and then your father's European. So that's your nationality. Are you married?
No.
Are you? So I would assume that you're single. And do you have a job?
Sorta, yes.
Yes, sorta. Tell us a little bit about your job.
I take pictures of people and their families and their seniors and just events in their life and edit them myself and then publish them for a little bit of a pay.
Very good. I'm very proud of that. So you have your own job. Tell me a little bit about your living arrangements. Who do you live with? Who lives in your house? And just tell me a little bit about your house.
I live with my dad, my mom, my brother, and my dog Checkers.
Okay, so you do have a dog.
Yes.
That's good to know. And it's a suburban house. It's 2-level house. Does have some stairs, and but essentially it's a one level is the main living area. Okay, and you have your own bedroom, and like I said, it's in the suburbs. As far as your diet, Natalie, tell me a little bit about what you eat, and just explain a little bit about what your diet consists of.
I eat normal stuff, just every day. Try to get the right nutrients. I eat a lot of chicken. I like chicken a lot.
Yeah, you love baked chicken.
And I also have some candy and ice cream every now and then, but I try to keep at least to only one soda a day, maybe a little bit more water, and try to eat the right stuff, but I do eat some certain stuff that could be taken down a few notches. Sure,
I think we could all do a better job with that.
Yeah.
So you pretty much eat a good nutritional meal. You eat pretty much a carbohydrate, a vegetable, and a meat or protein with every meal. You do like your carbs, and so do I, so I understand that. You are very good at drinking water, so we want to encourage you to continue to drink lots of water. And then exercise. Tell me a little bit about that. I know you just said that you got cleared for your sports physical, so tell me about your exercise.
Excuse me.
Uh-huh.
I felt it coming, but
It's
I guess.
okay.
Yep. Sorry.
It's okay.
So I do competitive cheerleading, and I also played soccer at my high school, and I was a competitive swimmer for around 13 years, and I work out a decent amount with that, especially now we're in the conditioning stage before our season, so we have workouts every day that we have to fulfill and send in. So a little bit less now in the quarantine stage because
Yeah.
we're at home and we don't have a gym to go to. We're kind of drains you a little bit, but normally I do work out a pretty good amount at cheer, doing running and lifting people up. So
Okay, well that's good to know. So Natalie is, I think you're pretty active, and you should continue with that exercise. That will help you, especially with your family's history of heart disease and such. Okay, and so Natalie, you explained that you do drink maybe one soda a day. So just, as far as caffeine, so that's, you want to limit that as well. And then Natalie, I don't know if you know what a laxative is. That helps you to actually move your bowels to go to the bathroom. So do you take laxatives as well? No. Okay, so I figured that was the answer. So the next question, it deals with some things that I'm pretty sure well, let me ask you. As far as smoking, tobacco use, even the smokeless tobacco that you would put on your front of your mouth there, have you ever had any experience with any of that? I know that a lot of the teenagers are involved with vaping. Is that something that you're aware of, or have you done that?
I am aware of it and I've seen it done, but I do not do that. Okay. And I definitely don't condone it.
Okay, very good. And smoking?
No.
Never smoked. Okay. And then anyone in your house smoke or anything?
No.
And are you around any secondhand smoke?
No.
Okay. And then alcohol abuse? Have you ever had any drinks or alcoholic beverages?
No.
Okay. And then what we call recreational drugs. Those are things like marijuana, cocaine, things like that. Have you ever had an experience with that? Okay.
No.
That's good to know. Okay, very good. So, Natalie, tell me a little bit about how you sleep, and share with me your sleeping.
I have a lot of pillows, and I like to get cuddled under the covers, and I sleep pretty good at night.
And how long do you sleep?
Long time.
And do you have a regular bedtime and a regular wake time? No.
Well, normally whenever we have school, but lately I've been sleeping in pretty long.
Sure, I understand that. So, you know that sleep is very important for our health. So, Natalie, how about stress? Are you under feeling any anxiety or stress or anything like that?
Usually I'm pretty stress-free. This pandemic has gotten me a little on edge because we don't know what's coming next for school and stuff like that, and we really don't know what is happening, so it is kind of a little bit stressful, but other than that, I'm trying to keep within the rules and stay home so that there is no way for us to get infected, so pretty stressful in that, stress-free in that case because we don't really have something that can hurt us here, so.
Yeah. How about your emotions? Do you feel sad or depressed or ever had any suicidal thoughts, things like that?
Pretty happy. Most of the time it's a little bit sad because can't go to Chick-fil-A.
What about hobbies? Do you have any hobbies?
I do. I like cheer. I do cheer pretty much year-round. At our school, we take it really serious, and like I said earlier, photography, I'm really interested in that, and I also like to do a little bit of hair makeup when it's prom season and stuff like that, so just a few things that I kind of have caught on and practiced a lot throughout the years and gotten a little bit better at as the years have gone by.
Sure. What about, when I say alternative health practices, things like essential oils or massage therapy, any of that? Do you ever participate, chiropractor, any of that kind of thing? Do you ever do that? Any of those types of things? No. Okay. And then what about, do you feel safe in your home?
I do.
Okay. Do you know if your family has any guns in their home?
We do.
And they're kept
in a safe.
In the safe. Okay, they're locked away safely. Yes. Okay. And then I know that you're a driver. You've been driving a couple of years now. When driving, do you wear your seatbelt?
Definitely.
Okay. And we'll continue to do that. So Natalie, now that we've done your social history, what we're going to do next is called the review of systems. And this is where I ask questions first, and then after that we'll do a physical assessment, which means I'll actually check you out. Okay, so as far as your review of systems, constitutional, you look very healthy, you look very well groomed, you look as if you appear to feel well. As far as your eyes, tell me if you've got any issues with your eyes. remember that?
Yeah, they're feeling really itchy.
Itchy. Are they draining or watery or anything?
This side is a little bit draining, so.
Okay.
And
then,
I think it might be from itching it so much with my hands. So.
And anything else? Ears bothering you, your mouth, or anything?
Yeah, occasionally. Right now, especially during the pollen season, I am feeling my ears kind of twitch a little bit, and it kind of sends a little bit of a blur.
Okay.
Because it gets my balance off.
Okay, so you feel like you might be a little bit off balance and maybe some fluid in there. So during the review of systems part, that's where you tell me what is has brought you here today. So Natalie, as far as have you had any change in hearing, drainage in your ears or eyes? I know, have you had any runny nose or congestion?
I actually had a really runny nose today. It was just pouring out, so I had to get a Kleenex.
Sure. What about your throat?
No, I just feel a little bit of mucus in it. Probably think from the backage up in the nose. So, but other than that, not itching or anything.
No pain. No pain there. And how long have you had this runny nose and itchy eyes and itchy ears?
Just ever since the pollen happened. I think it was about 2 months ago, but I've had this happen during this season for as long as I can remember. So usually from about February to maybe May, I have a pretty bad allergies, and it just never goes away no matter what happens. So.
And have you tried anything to help that?
I did. I took weekly allergy shots for I think about 2 years, and then I also try to keep up with Zyrtec or an allergy relief pill, and even though I really can't stand it, I do take Nasonex when it gets to the point that I just can't handle it anymore. So I know I should be using it religiously because it does help whenever I do it, but I'm really sensitive whenever it comes to sprays and eye drops and stuff like that. I also used an allergy eye drop once, and took me a good while to get them in the eyes, but after I got them in, it did really feel better pretty much instantly. So
now so as far as like have you had any sores in your mouth? Have you had anything like that? Okay, so when was your last dental visit? I think you missed your last one, but
I think it was February, maybe, because I remember had to leave school one day and then come back because we had a basketball game. So I think it was February.
That's good. What about eye exam? Do you remember that?
Ooh,
it's been a while.
Every time I go to the doctor for my physical, they say I have perfect vision, unlike everybody else in my family. So I think I'm pretty lucky on that case. I haven't really been able or had to go and get my eyes checked out. Because getting them dilated kind of hurts.
Yeah. What about any chest pain, any shortness of breath, anything like that?
Just that yesterday or the day before, whenever I had a really intense workout after laying in the bed all day for the quarantine.
Yeah. What about skip beats? Your heart? Do you feel like your heart flutters or skip beats or abnormal beats or anything like that? Okay. And have you been coughing?
Just here and there, not really anything that I really feel is affecting me.
Okay. And you said you did not have shortness of breath, chest tightness, or anything like that, difficulty breathing. As far as like allergy and immunology, do you feel like you've got any rashes or any type of allergies to foods or anything like that? Have you noticed anything there?
Usually in certain types of grasses, whenever I get in them, I do feel my body kind of break out and start itching. So I do feel like the grass allergy is kind of intense, especially in freshly cut grass. I have noticed that freshly cut grass really impacts my allergies, not only in the nose and the eyes, but also it makes me really itch if it even just brushes it against me. So I do feel like the freshly cut grasses.
Yes, definitely. Antagonizes it.
And when I played soccer, I would get pushed down or roll around and trip over my own feet even. And one time I had to go to the emergency room because I had hives everywhere, and it was not fun because I couldn't even see. My eyes had swollen shut. So.
Are you still able to see me in the video now that I've stood up?
Mhm.
Okay. So, very good. So that was called the review system. Oh, excuse us. Sorry.
Okay.
Okay. All right. So, sorry. So that was a review system. The next thing is called the physical exam. This is actually where I perform the exam on you. Nothing will hurt, just to kind of ease your anxiety or anything like that. So the first thing I do is, it's called the constitutional part. They're general, and I'm kind of evaluating you as you walked in. I was evaluating how your gait or how you walked in, how you are sitting. I evaluate your how you're dressed. I'm actually smelling to see if there's any odors. I'm evaluating your grooming to see if you've brushed your hair and your teeth and if you keep well groomed, all of those things. I've also evaluated your speech, and I know that you can hear well because you're able to answer my questions and you're able to verbalize back. So those are some of the things that I've looked at. I've also looked at your skin and just kind of analyze that. So those are all the things that in my head that I'm looking at. It's part of your physical exam. We don't necessarily verbalize those at a physical exam, but those are all things that we're looking at. So the other thing is, next I would also look at your vital signs. So I know that my nurse took your vital signs earlier. You had 98.6, which is a normal temperature. So we know that you don't have a fever. You've not had chills. You've shared with us that. Your blood pressure was very good. It was 110/70 because you're super healthy. And your heart rate was normal as well. The reason I bring that up is we know that you're not dehydrated. A higher heart rate would indicate you might have a dehydration or infection, and you don't have that. You are 5'5". She shared with me your height. She shared with me your weight as well. Your BMI is within normal limits, so we're proud of you for that. She also, what she did, because part of your exam you shared was that you had itchy eyes, so she did your eye exam. And as you said, when you saw the eye doctor, he shared that you had 20/20 vision. You've got good vision. So she did look at your eye chart. So that was something else that the nurse had already shared with me on your vital signs. And then the next thing is looking at, we start from head and work our way down. And because this physical assessment is only on pertinent systems, that means I'm only doing systems that are related to what you were sharing, your runny nose, your itchy eyes, and your itchy ears. So I'm going to start at your head, and I'm just going to kind of look at your head to make sure that it's normal and there's no trauma to it. There's no issues. Your hair looks healthy. There's no lice or anything to be concerned about with the grooming. It is normal in appearance, and then we would move down to your eyes, and I know that you did share with me that your eyes were itchy. I'm just going to kind of take a peek in your eyes and make sure that your pupils are equal and reactive, and I'm also going to look at this pupil to make sure that it's reacting opposite. So I'm going to shine this bright light. If you can just look at my nose, and I do see that your pupils are reacting. I'm looking at your eyes to look at if your sclera is reddened or yellowed, or different colors. I don't see that. I don't actually see any drainage. I do see a little bit of glossiness, meaning that you have a little bit of allergy eye, but I don't see that there's any issues with that. If we were wanting to do a neurological exam, I would have you follow my finger to do a 6-point neurological exam, but I don't have any issues with you there. The next thing I would do is I want to take a peek in your ears, just to make sure that you don't have any redness or drainage or anything. I'm looking for the cone, and you actually have very clean ears.
Tickles.
And does it hurt on the inside, or the mastoid process on the back? Does any of that hurt? Any of that? And Nathan, I'm sorry, I'm gonna have to go on this side here. Yeah, you got some nice ears in there. So we're looking in your ears, and I know that you don't have any, what we're looking at is just on the external part, mastoid, There's no issues, no redness, no protrusions, no lesions or anything like that. Natalie, now we're going to look in your nostril. I'm just going to look up in here just to look to see if you've got any redness. I know that tickles. There's a little bit of redness and some clear serous drainage there. And what I'm going to ask you to do, Natalie, is I want to see if you have any congestion. If you could just block one nostril like this and see if you can breathe in that nostril. Having some trouble there. How about the other one? Okay, so you are congested, and I can hear that you have some runny nose. I'm looking, if you could stick your tongue out and say ah. Oh, I see that you've had some candy. And your uvula, your uvula looks good. Your tonsils look good. Well, actually, your tonsils don't look good because you don't have any tonsils. Did we mention about surgery earlier? We didn't. That's good to know. So, looks like your tonsils and everything, or your throat looks good. You don't have a sore throat. I'm feeling for any swollen lymph nodes along this way and here, and I don't feel any swollen lymph nodes. And so we look at next cardiovascular, and so we listen to your heart. You'll take a deep breath in. I'm sorry, listening to your heart first. Aortic, pulmonic, and tricuspid. Okay, sounds good. All right, now we're going to listen to, and I'm going to listen for bruise. If you'll hold your breath and let go, and hold your breath and let go, and I do not hear any bruise. If you'll take a deep breath in and out, in and out, in and out, in and out. And listen to your back too. In, out, in, and out. All right. Now listen to your upper lobes and your lower lobes, and you do sound clear. There's no wheezes, no rhonchi, no wails, anything of that nature. So we also want to look at your skin to make sure. A lot of patients that have allergies, also if they have asthma, they would have skin allergies or eczema. So you said you do not have any of that. So as far as the physical exam is concerned, I looked at constitutional, we looked at your vital signs, I looked at your HEENT, I looked at your cardiovascular, your respiratory, and your integumentary for the physical exam. And so, Natalie, as far as what I think is going on with you, because you stated earlier that you have a runny nose, itchy eyes, and itchy nose, I believe that I have diagnosed you with what's called allergic rhinitis. And that's based on your symptoms today in my physical assessment. Although there are some differential diagnoses, meaning other diagnoses that it could possibly be, I'm going to rule those out. And the reason why is it could be allergic conjunctivitis, meaning that your conjunctiva in your eyes could be allergic or reddened, and I'm ruling that out because you don't have reddened eyes. Okay, so I will also rule out upper respiratory infection because you presented with no fever. This has been going on for a little bit more longer of a time. As far as an upper respiratory infection, I would think that that would be about a week, and then with that, it would indicate that you might need some antibiotics. I don't feel like you need any antibiotics today. So Natalie, the plan today, as far as orders, lab orders, because this is your exam that you've come back and you need to kind of have some labs drawn, and since we're going to get some labs, I would do an IgG or IgE to look at your allergy antibodies, and then while we're doing that, we might as well do a complete metabolic panel, CMP. We could do a CBC just to see what your hemoglobin is, especially for a 17-year-old lady with menses. We want to know what your hemoglobin and hematocrit are. So those are important as well. I don't feel like you need a pregnancy test at this time. So that's something that you want to make sure that you ask the teenagers and women of childbearing age if they do need a pregnancy test or if there's STDs that they may be concerned about. I don't have those concerns today with this particular patient. As far as medications are concerned, I'm going to give you a prescription for an intranasal corticosteroid. Actually, you've tried this in the past. It's called Flonase. So I want you to make sure that you apply that appropriately. You want to place it into your nose, kind of lean your head down a little bit, and one squirt on this side, but you don't have to forcefully have that in, just like that into this nostril and then the other nostril. Along with that, I'm going to also prescribe you an antihistamine. I know that you have taken Zyrtec in the past, and so that antihistamine is a good one for you and your family. Sometimes you can develop a resistance to certain antihistamines, so if you feel like you've tried Zyrtec for a while, you may want to try Allegra or Claritin. Both of those also are over-the-counters that you could try, and then take a kind of a break from the Zyrtec and then go back to the Zyrtec after you try the Allegra or the Claritin. Natalie, you can also try a decongestant or a Sudafed. You don't necessarily need that unless you're just continuously running, but all of that will also help with the allergy eyes and the itchy nose. So, and then obviously will help you with your runny nose. So the other thing, non-pharmacological issues that I would give you, I would give you the neti pot. I know that you don't like the neti pot, the saline, but I would recommend, doing the nasal saline through your nostrils as well. Natalie, I would also suggest that as far as patient education, you want to avoid dust, pollen, animal dander. You might want to get rid of the dog. No, I'm just kidding. You can't get rid of your dog. But lots of vacuuming. You might suggest a HEPA filter to your parents for your room to clean the pollen and the dust and dander. As far as a referral today, I don't feel like you need a referral. But if this were to become more severe and more serious, we would refer you to an allergist for immunology testing that you had in the past. I don't feel like you need that today, but I'm going to bring you back in 1 month. Or if you need to come earlier, if your symptoms get worsened, or you feel like you need more of an emergency, you may always come back and visit or go to the emergency room. But we'll bring you back in a month, and at that time we'll kind of reevaluate how things are going. So Natalie, as far as what we've got going on here and all of the patient instructions that I gave you, do you have any questions for me?
Not today.
All right. Well, thank you so much for the physical assessment, and I hope that you will see me back in a month.